this down because I know this might help some remember it better than just putting down the straight definition. So tendons allow for the movement. Allow for the power of movement across joints. So MTB, muscles, tendons, bone. So that's a connection. Muscles, tendons connect muscles to bones. Ligaments, BLB, bones, ligament, bone. So that might be one way that some of you guys can remember that. So I'll give you guys a little bit. Go ahead and write this down, and I'll continue on. All right. All right, cool. So here's a visual in case the bulletin by itself or the PowerPoint by itself didn't help. Skeletal muscle, you find exteriorly. It's what allows you to move your muscles, move your body, I'm sorry, cause flexing and contraction. Cardiac muscle just continuously operates by itself. And smooth muscle is involuntary, meaning that, okay, so it's showing the stomach. Once you chew the food that you have in your mouth, you're chewing it with your skeletal muscles, the muscles on the outside of your cheeks and your mouth. Once that you chew that food down, you create a bolus. That chewed up food is called a bolus. And then you swallow that, still using your skeletal muscles. Now, once you swallow that food and it hits your esophagus, it's hitting smooth muscle. And that muscle contracts by itself. And the movement that it's using to move the food from the mouth down to your stomach, and I'm talking about the esophagus here, the movement is called peristalsis, okay? And I might not be pronouncing it right, but if you ever want to look it up, it sounds something like that. And it should be in your textbook in more than one occasion. But that's the movement that smooth muscle use to move food down through your esophagus and then also down through your intestines, small intestine and large intestine. It's called peristalsis, is the movement of objects through smooth muscle. Another visual. So I'm gonna go ahead and give you guys just a few seconds. Take this in, study this real quick to get a better idea of what tendons and ligaments do and where they are. All right. General guidelines for care. Let's see. So there's direct force, indirect force, and twisting force. So direct force, that's talking about, let me see, give me a second. Let me get my words together here. All right. Let's say that you're driving your Cadillac, right? Because you have a Cadillac because you're cool. You do that stuff. So you're driving your Cadillac and then you hit a brick wall. So when you hit that brick wall, there's something called down and under injury. So down and under injury means that you were driving your vehicle and you slid down and under as opposed to going over your steering wheel. So if you were to go down and under, when your heel or the bottom of your foot hits the inside of your car from you going forward, that's a direct force. That knee or the bottom of that foot hitting the inside of your car, that point right there is direct force. And indirect, and that can cause a break right there. So if your foot is broken is caused from direct force because it directly hit something. Indirect force would be that energy that, so let's say you hit the car with your foot, the bottom, you slid down hard, but it didn't break your foot. And instead, that energy kept on going through your leg, up your leg, and it ended up breaking your tibia or your fibia. Now that's a break from an indirect force. That means the force traveled along the pathway of your bone and eventually broke somewhere. Twisting rotational force, that means you just broke based off twisting. That happens a lot in sports. So let's see if, okay, what else we got here? So we talked about direct force, indirect force, twisting. So these are just examples of fractures. So any break in bone, open or closed. So again, a fracture could be open or could be closed. It's like any other trauma. Comminuted bone means that they're broken in several places. So whenever I hear this word, I just think of something shattering. So if you just think of a bone just shattering and fragmenting, that's comminuted. I'm not sure if I'm saying that right or not, but that's what that word is. A green stick fracture is an incomplete break. So the green stick fracture is found a lot in the pediatric population. And the reason is because, well, let me back up a little bit. Let me break down, give you a visual of a green stick fracture. A green stick fracture is when you have a slight bend or a very obvious bend on a bone, right? Let's say it's a humerus, the long bone on your arm. There's a bend on that. Your patient has a bend, but it's only partially broken. It's like a hairline fracture, but it's still bent even though it's not broken all the way. And the reason that happens in pediatrics is because their bones aren't solid yet. They're still somewhat flexible, and that's why when you're doing CPR on a baby, you're not gonna break ribs because they're really, really flexible on babies. So green stick fracture is found on pediatrics, and it's because of their bones not yet solidifying all the way. I hope that makes sense. Angulated bent, bent angle, bent at the angle, bent at angle, and that's just you broke a bone and there's an angle on it now. See injury to bone and connective tissue. So that right there would be a dislocation. That, you see how the bone is protruding out? The bottom of that thing, that's gonna be the tibula. And that right there is a dislocation coming apart. And then write down your definitions for your sprain and your strain, because these are also, people get confused with these as well. So a sprain is stretching and tearing the ligaments, all right? A strain, we're talking about the muscle. I'll give you guys a minute or two, write that down.
So a sprain would be referring with the ligaments. So, and then strain, would that be referring to like tendons?
No, now the tendons may be affected because they're attached to your muscle, but it's just a reflection of your muscle itself.
Okay, but so is there a term referring to like when someone injures a tendon?
Not as far as I know, unless it's on the next PowerPoint that I haven't seen, but no. But I guess
Okay.
it could be a strain would be associated with tendons.
Okay.
So sometimes they may, I can see, depending on how you were trained and the way you think, that somebody could either take it as a muscle injury or a tendon injury. And it's just based off background and education. So yes
Gotcha.
or no is the answer to you. Yes or no.
Gotcha.
All right, so not all injuries can be confirmed as a fracture in the field. Sometimes your patient just may have a really big hematoma and it may look like they have a fracture, but it really is just extensive tissue damage. And I talked about a hematoma, and a hematoma it's just a really, really big bruise. Okay, a lot of vessels are damaged, a lot of tissue is damaged. See, splinting an extremity with a suspected fracture helps prevent blood loss from bone tissues. I don't think I have to explain that one because I already talked about that.
Hey, Mr. Mendoza.
Yeah.
So would a green stick fracture, would that be kind of the same as a hairline fracture, or is that totally different?
Again, yes and no. So a green stick fracture will have a hairline fracture,
Okay.
but also on a grown person like you and I, we'll have a hairline fracture, but obviously we won't have the bent because we would have a complete break. So a hairline fracture for us, the bone would pretty much still be intact. Does that make sense?
Oh, okay, I got you.
Yeah, it'll still be straight, but it's just a hairline fracture. So that means that the force that hit us was strong enough to crack the bone, but it wasn't strong enough to break it all the way. But yes, a green stick fracture will have a hairline fracture. I hope that makes sense.
Okay, yeah, it does.
Okay, cool. All right, let's see. Assessment of musculoskeletal injuries. So rapidly identify and treat life-threatening conditions. That's always your priority, guys. ABCs, life threats, all right? Be alert for injuries besides grotesque wounds. And I've always hinted at this and I've always talked about this. Never ever let something nasty take your attention. Just because it looks nasty doesn't mean that it's life-threatening. A good example, the example that I always use is like this meat hanging off the forearm. So an avulsion of the forearm, that's gonna look disgusting, really bad. But is it life-threatening? There's a good chance it's not. It just looks really nasty. All right, let's see. Cut or remove patient's clothing to complete examination according to the environment and severity of situation. That's pretty self-explanatory. Compartment syndrome. So if you have a hematoma that's really bad, or even a fracture, a bone fracture, whatever the cause is, what can happen is that that hematoma causes so much pressure within that extremity, like the forearm, for example, that blood's not going to be able to move through that hematoma. There's so much pressure that in a sense that hematoma is creating a tourniquet and preventing blood from getting to the peripheral, the end of that arm from the core of your body. And that's what this is talking about right here. So obviously, if the pressure keeps building up or stays the same to where it's not allowing blood flow, the tissue at the peripherals will eventually start to die off and get damaged. So assisting in restoring effective circulation to extremity and to fit it to a splint. If not realigned, splint may be ineffective, causing increased yeah, so before you ever splint an injury, before you ever I got it right. Splint an injury, you always want to realign it, okay? The only time that you're not going to realign an injury is going to be a knee injury, and that's because you can cause more damage because there's so many vessels that are traveling to that area. Besides a knee injury, you always want to realign the injured extremity, and that's because you want to restore perfusion and circulation to that. If you leave it how it is, it's not going to perfuse adequately, okay? I hope that makes sense.
Yeah. So if someone just snaps like their forearm in half, you're gonna want to put it back in like a straight line and splint it.
Well, you mean like they just like cut it off? No, that's an amputation. Amputation is different.
No, not an amputation. If they snap their forearm in half, and it's just completely dangling.
Yeah, absolutely. Yeah. Yes, you just want to clean it off as much as possible. Get off of the nasty debris. Wash it off with some saline as possible, and it's gonna be nasty, so you want to be quick about that. And then you just put it back in place. Absolutely, yes.
Gotcha.
All right. Realigning deformed extremity. So if not realigned, realigning of the deformed extremity. If not realigned, increased chance of nerves, arteries, and veins being compromised. And I just talked about that right now. Increased pain is only momentary. So when you do realign a joint or any extremity, your patient is gonna go through a lot of pain, but it's only momentarily. After that, it's gonna feel a lot better. See, guidelines on wanting. So instead of talking about this